Hi everybody, it's Dr. Magnifico from veterinarian.com. This is Stella. She's about 7 months old. She is here today for her spay. I thought I'd go over a couple of the things that you should talk to your vet about before you spay your dog. We're just going to talk about dogs today. So Stella has all of her puppy vaccines. She's on her preventatives. That's her flea, her tick, and her heartworm. We've done a fecal sample to make sure she didn't get any intestinal worms. Really, that we did that when she came in as an 8-week-old puppy. She's been coming here since she's 8 weeks, so we've seen her quite a few times. She's comfortable being here. She does well here, and she's just a very social, happy dog to begin with, so that all helps. Some of the things that we do the morning that they come in, we certainly want to make sure they haven't had any breakfast. It's important for them to not have food in their stomach so they don't aspirate. That's one of the things we talk about with you when you schedule your appointment, is to make sure there's no food or water after midnight. We're also going to talk to you about any possible complications that we might be concerned about. If you have an older dog or an overweight dog, it makes it more difficult to do their spay. So we talk about things like placing a catheter, maintaining and monitoring blood pressure, and all the rest of the parameters that we use when they're under anesthesia. We're also going to talk to you about the extra time involved in an overweight or obese and sometimes even pregnant dog. So those are things to talk about. Understand what your extra costs might be and what extra precautions your vet might want to take based on your pet. Your spay should be tailored to your pet, which is one of the reasons why I sort of discourage the high volume spay and neuter places. You just don't get that chance to talk to your vet and understand what's going to get done, how the procedure is done, and then what the recovery will look like, and how to best take care of your pet. So she is a very young, healthy, fit dog. We're going to give her a pre-med, so that will sedate her, and then we'll give her anesthesia. She'll be intubated, she'll be on the surgery table, and we'll be monitoring her. I have a technician who stays with me the whole time, so she's going to be the focus of our attention, and and hopefully she will just be one of those routine spays. A spay is a pretty significant surgery. It's an ovariohysterectomy, so for women it's a really big deal. We tend to downplay it in dogs because we think of it as a routine surgery, but really, of all the surgeries that we do, it can be one of the most difficult things that we do. So understand what your dog needs, what your vet's prepared to do, understand your vet's surgical technique level. If you are dropping your dog off at a high volume spay and neuter clinic, you might get someone who's done that very, very routinely, and they're very, very proficient, and you might get somebody who's there sort of just as a newer veterinary graduate, and they may not be so comfortable with the spays at this point. So there are lots of questions to ask, lots of things to understand, and understand who your vet is and what they're prepared to do for your dog so that your dog has an optimal surgery and recovery period. I have a blog on what questions to ask your vet about spaying your dog, so you can go there. It's under Krista Magnifico, Diary of a Real Life Veterinarian, and it will explain to you all the things to talk about in the room before you schedule your dog's spay. So I think that's it. We're going to get started on Stella, although she looks like she's pretty calm and relaxed and ready for a fun day at the hospital. If you have any questions, you can reach me anytime at jarrettsvillevet or probably.com. So we'll wish Stella luck. Good luck, Stella. We'll see you in a couple minutes. Take care. Bye.